Welcome to the 2020-21 season of IPHA's third Thursday Lunch and Learn web series. This is a web series that's organized by the IPHA Education Committee. My name is Anjali Deshpande, and I am a clinical associate professor in the Department of Epidemiology at the University of Iowa College of Public Health, and I currently serve as chair of the IPHA Education Committee. So I welcome you all here today. We dedicate this time every month for all of us in public health to share our successes and even some of the detours it may have taken for us to get here. So not just the successes, things that we've done, but things that are in progress as well. The point of this Lunch and Learn web series is to connect, learn, and strengthen the voice for public health in Iowa. So we're glad that you're here, and we hope that you'll be back with a friend next month. Tell your friends all about it, I think you're going to find that this is a really informative, very informal kind of session that we do. Today, we're talking to Kelli Gerdes from Cerro Gordo County Public Health, who will share with us her work as a de Beaumont Fellow, specifically around the phrases toolkit. And she's actually going to tell us more about this here in just a minute. I just wanted to touch on a couple housekeeping items. First, your microphones are muted and your video is turned off by our lovely administrator, Lena, during the presentation. You will be able to unmute yourself and turn on your camera during the question and answer part, because we absolutely want you to be participating in this and to ask Kelli any questions that you have or comments that you might have. You can also feel free to put questions into the chat or the Q&A features down along the bottom in the control panel for Zoom, because again, we want to capture your questions and comments as we go. This session is being recorded and will be posted to the IPHA YouTube channel. So if you want to view it again, you can do that. If you want to be able to share it or recommend it to a friend, by all means, you'll be able to do that after the session is over. All right, so as I said, today our speaker is Kelli Gerdes from Cerro Gordo County Public Health. Kelli is no stranger to all of you out there participating in this webinar. Kelli is very active in our public health community here in Iowa. And in 2019, she was selected as a de Beaumont Fellow to be involved in vetting and evaluation of the phrases toolkit, which the de Beaumont Foundation was developing with a set of other partners. Kelli is joining us today to share the toolkit with us and to describe how local public health practitioners can use this toolkit in their work, especially around collaboration with other sectors in their community. So she's going to give us kind of a navigation of the toolkit, tell us a little bit about the background of how it was developed, and primarily her involvement in this, this great kit. Welcome, Kelli. Thank you for joining us today. We're really looking forward to hearing about phrases and your involvement with this. I'm going to turn this over to you. I know you have some things to share with us.
Yeah, thanks, Dr. Deshpande. So yeah, thank you guys all for tuning in. Hopefully this isn't too much of a repeat, but I did present a little sneak peek back in, I think like April or May, as part of the Iowa Governors Conference that went virtual. And we talked mainly about how to best tell a story and how to strategically frame your message. So today the tools have actually been launched since then. So I want to visit the website with you guys and just show you where you can find everything and things that might be most helpful to you guys when you're starting that collaboration and partnership with other sectors outside of typical public health entities. So as Dr. Deshpande already mentioned, there's a group of 15 of us fellows from across the country that were selected by the de Beaumont Foundation to kind of vet the tools. And then we've been tasked with kind of going around and spreading the message about how to use the tools, where to find them, that kind of stuff. So the overall goal with the tools and the toolkit was to assist public health workers, particularly from like small health departments that don't have a lot of expertise in professional marketing or communication to help them improve their communication skills, to collaborate better with others in advancing our public health projects, messages, just public health in general. So I found them helpful. My background is in exercise science. I didn't take much in communications other than the required speech classes. And I know in North Iowa, we have really small health departments for the most part, and they don't have specific marketing professionals or public information officers per se with that particular training. So I think that's where these tools will come and help, is for those smaller departments who are trying to tell a message, get their information out, but do so in a way that will resonate with audiences, and kind of give them that background education to feel comfortable in crafting that stuff. So I'm going to try to share my screen and show you guys the toolkit here. So the best way to get to it is going to phrases.org. You'll see up here in the search bar, and it'll take you straight to where the toolkit has been launched. And so there was sort of a 4-step process that took place to develop these tools that I'll talk about briefly, and then we'll jump into the tools. So under the About Us tab, again, it'll talk to you about the fellows and everything, but our 4-step strategy was really, one, figure out a way to move small health departments and large health departments towards that public health 3.0 model. And as our director will say, towards 4.0, you know, maybe we're already past 3.0, maybe we need to keep going. And so obviously collaboration is key there. We have to stop thinking of ourselves as a health department with 4 walls, but more as public health, where we're in every entity and every organization, and we're a culture versus a building. So then step 2 was a lot of research and finding out the gaps with those other potential collaborators, and there may be misinformation with what public health is or what we could offer them or how we could collaborate. And then step 3 really is that toolkit will help bridge those gaps to ultimately drive the change, which is our overall goal, with helping health departments that forward-thinking process for public health. So in prepping for this, I was meeting with Dr. Deshpande yesterday, and I'd mentioned that in April, I had showed a quick snippet of a video just illustrating how outside sectors view public health, and maybe how we think they view us is different than how they view us. So I'm going to just show it to you real quick, just so it kind of sets the stage for how important it is that our message truly resonates with our audience. So hang on one second while I swap screens here. So this is a video that was produced by Frameworks, which is an institute that we'll get into a little bit later on framing, but did some background research with different segments of the community in the business field, in the education field, in the housing sector, healthcare, medical sector, that kind of stuff. And they just asked them various questions about public health and recorded what their responses were. And we at Public Health probably think we're doing a good job of communicating who we are, what we are, but it was just interesting to listen to their generic explanations of who we are and how much work we maybe have to do to continue to really build some robust partnerships with them. So I'm going to jump ahead here to just a little snippet of what this is about.
If I were to ask you what is public health, how do you think you would answer that question?
Not an easy question to answer.
A lot of doctors have masters in public health, but I'm not sure what it entails.
If you work in the public health profession, aren't you concerned with policy or something?
When I think of public health, the first thing that comes to mind is healthcare for the poor.
Dealing with the healthcare needs of the indigent.
Certain facilities that are operated and funded by the government.
When I think of public health, I think about the CDC.
I think, first of all, the CDC and then the local Department of Health.
I think of the CDC. They kind of inform
educated people about the different viruses and things they can catch if they don't protect themselves.
Identifying patterns so that certain things don't happen, outbreaks.
Like infectious diseases, and if the produce is tainted, then, you know, the public needs to be informed.
In the work that you do in your field, Do you ever collaborate with other fields, people from other sectors?
Well, I'm on a board for the city. I do a lot of planning, volunteer.
I'm a Girl Scout volunteer, and I work with a low-income community.
We get a lot of guest speakers.
Bring industry people in, because at that point, we're trying to get the students ready for the real.
We sell to people.
Sometimes it's one of my customers, and this is a different line of work. Drug reps and are coming in continuously.
Have any of you ever collaborated with public health professionals?
They're the ones who can tell us that syphilis is on the rise. They're the ones who can tell us other infectious disease screening is usually helpful.
I mean, with the epidemic of the colds and flus, you know, we have had people come and talk to our kids about how to keep themselves healthy.
To do immunizations, bringing the flu shots to the city colleges.
To make sure that everybody had their proper physicals, immunizations.
Okay, so as you can see, there's probably a little bit of, I would say, traditional responses to those questions. If you're in public health, you know, oh yes, that's where you go to get your immunizations. And probably for sure right now during COVID, a lot of people think maybe we're just involved in tracking disease outbreaks and that's it, but so much more that's going on. And I thought another thing that was interesting in those conversations, when they asked about what kind of partnerships they had outside of their own organizations, it was pretty limited, and it wasn't necessarily what I thought of as true participants or collaborations and partnerships. So, you know, they talked about, oh, well, the healthcare setting brings in drug reps. Well, okay, but is that truly a good partnership that's advancing, you know, overall community health or particular clients or that kind of stuff? So really, as public health, you know, hopefully we're leaning towards doing more and more collaboration and getting out into all these sectors and really showing them the value of public health and the importance of working together to advance these things across the community. So that was just a quick snippet. Now I'm going to go through and show you some of the tools that are on the website. So hopefully you can see the website now that I switched over there. So at the top are some toggle buttons. If you go to the toolkit, this is where you'll find most of the tools here. And these are tools that have been produced by professionals, and we as the fellows are just sort of vetting them to see what makes sense and what doesn't, and that's what you're seeing today. So like I mentioned in April, if you were part of that session, I talked mainly about strategic messaging as a little precursor to the full toolkit. So it talks about, if you would visit this section, it will be more specific for maybe your public information officer or someone who does your social media posts or that kind of stuff on specific words that you should use, words that resonate with different audiences, how to best tell a story, so storytelling techniques, the importance of always including a solution in your messaging, not just the problem, showcasing the expertise of public health, and on and on and on. So if you're someone who's really into crafting messages, I would look further into the strategic messaging. And I don't want to bore you because I went on a lot of that last time. So I thought I'd just kind of give you the summary page of that particular one. One area that I find most fascinating during the fellowship was this idea of framing our conversation and framing our words to make it invoke change in that person to be part of the solution and to get them invested in whatever ask we're requesting. And so if you're familiar with the Frameworks Institute, they are a company, I believe out of the East Coast, but they did a lot of background research for our project and did a lot of focus groups and one-on-one interviews and stuff to see exactly how we at Public Health could reframe our message to make it resonate and feel more of an investment with others. So one example I always give is, you know, a lot of us at Public Health, we know obesity is on the rise. We know it's a crisis. So a lot of our messaging might be, you know, oh, Sarasota County has a 35% obesity rate, you know, things need to change. But if that's our message, there's a couple reasons why it might not necessarily resonate with a lot of people. One, we haven't really, in our message, created a way where it resonates with people that aren't obese. You know, they might read that and think, well, that's someone else's problem. I'm at a healthy weight. I don't have to worry about any projects that deal with obesity because I can take care of myself and that doesn't apply to me. in reality, as public health, when we share that message, we're trying to draw the community to think, oh, this is a community problem. We all need to work on it together. But what our message is actually saying is, just those people that are obese need to work on it. The rest of the healthy people don't have to pay attention. And that's not what we want at all. So how we frame that message is certainly very important. I'll show you, I'm going to switch slides here real quick because I was trying to find a video clip that did a great job of illustrating it, but I don't think they were allowed to share it with us. And so I'm just going to show you a different one here. So first of all, frames are sets of choices about how our information is presented. So it's kind of how we want to emphasize it, how we want to explain it, and what we want to leave unsaid. It's not necessarily the actual message, but how we want people to feel about it. And so an example of a well-framed versus a unframed, maybe a different frame example is here. So the first option says, given the importance of free speech, would you favor allowing a hate group to hold a political rally? And 85% of people that were asked this question were in support of it because of the emphasis on the importance of free speech. So they asked the exact same question, would you favor allowing a hate group to hold a political rally, but with the preface of, given the risk of violence, would you allow a hate group to hold a political rally? And only 40% were in favor. So we're asking the very same question, but we're emphasizing two different features that change the response of those people. And so, when I was mentioning that obesity thing, a better approach would not be necessarily to say, 35% of people are obese and, people need to make better health choices or whatever. We need to think of a better way to say how we want the community involved, to create a solution for obesity as a whole, as a community versus an individual reason, and reframe our message around that. So anyways, I just thought those were interesting. The videos that I was hoping to share did a good job of showing lots of examples around public health issues like tobacco, smoke-free housing, that kind of stuff. So initially when you go in and ask, people off the street, are you in favor of smoke-free housing policies? Their first response might be, no, it's an individual choice. Everyone should be able to make a decision about if they're smoking in their home or not. But if you rephrase it saying, did you know that, I'm just going to make up a number here, but 70% of children who live in housing facilities where smoking is allowed perform X, Y, and Z worse in school, it might change their impacts on if they think smoking should be allowed in multi-unit housing or something like that. So again, how we frame the question can help resonate with a person on their past experiences and what they hold in value, and how then we get their response and participation on our end. So I truly encourage you to look more into the framing section. Like I said, I think this was the most impactful for me as public health, because I never thought of myself as being able to change someone's mind necessarily. I figured, oh, they have this, they have this thought or this thought, and if I catch them and they're on my side, great. If they're not on my side, I'm going to stop wasting my time on them. But with framing, it's a different perspective. It's just twist your words or change your words so that you can appeal to one of their values and get you on their side, no matter what political side they're on or anything like that. So that was really interesting to me. So I encourage you to look into that. There's three big things they pulled out of framing that I'll just gloss over real quickly. One of the big things was, we in public health talk about social determinants of health a lot, and they found in their focus groups and in their research and individual interviews and all that kind of stuff that term, social determinants, really fell flat on everybody outside of the public health sector and a few people in the medical field. It just seemed like a far off thing, and they couldn't necessarily relate how social interacted with physical health and mental health and that kind of stuff, and they just really didn't see the correlation. So what they consider, instead of using the term social determinants of health when you're trying to show why housing or transportation or whatever should be part of public health projects, is to use the term foundations of community health. So think of it more or less that all these different players are the building blocks of your community, and they all have to be set on a solid foundation and moving in the right direction to give a healthy community a chance. So housing has to be a solid block, transportation, education, you know, all that kind of stuff. Those are all the foundations that build a healthy community versus social determinants of health, which they found was kind of an aloof verbiage. The second frame that they considered public health used to explain themselves is to think of us as GPS navigation. So I mentioned earlier that, you know, to me, Public Health 3.0 is a health department no longer fixing itself into four walls in the department, but we are just, you know, it's like a gas in the air. We're just everywhere. We're in everyone's thought processes and stuff like that when it comes to making decisions. So as public health professionals, we are just the navigators to get organizations all moving in the same direction. We might help them navigate over road closures, bumps in the roads, that kind of thing, but we're still all steering the partners in the same direction for community health benefits. So another way to kind of think of public health and make it resonate with a familiar analogy that people know about. And then the third frame is using the term value of investment with other sectors. Again, this comes back to the part of what's in it for me when you're trying to collaborate with other people. Public health, a lot of times we're just having an ask, you know, we go out and ask for these things, but we sometimes don't do a good job of showing how they are going to benefit from what we're asking of them. You know, schools might be a good example. Right now, we're asking schools to report their disease surveillance quite regularly, and it's a lot of extra work if schools haven't been doing it already, and they're just wondering why. You know, we know it's a state mandate and stuff, but what's in it for us? And if we could come at it from a perspective of, well, you know, school really relies on attendance and getting those kids there. And if we can identify hotspots or things like that ahead of time, we can help to keep those kids in school and stuff. So again, making that conversation so that they understand that what the time and the energy and the money that they're putting in, they're truly going to always get something back in return. So it's truly an investment. So those are some of the big framing ways that you're going to want to frame your communication. And I would encourage you to jump into these more. I don't want to go into detail and bore you, but I found this area the best set of tools, I think, for when I'm trying to craft my messages. So then there's some more specific tools that I'll just jump into real quick before we get to the Q&A. The first one is called When You Say, They Think. And so this is for just some examples for 4 different sectors: business, housing, education, and healthcare. So they're just some, I'll open it up here. Common public health things we might ask of different sectors and how we ask it, but then how they might interpret it. So for example, if I'm a public health professional and I'm working with a landlord, I say, adopt smoke-free policies to keep your tenants healthy. Well, if I say that to them, typically what they hear is, more policy, that sounds expensive. It's up to individuals to adopt lifestyles. You know, what do public health professionals know about the housing industry? Like, stay in your own lane, you know? So what we need to do is come from that foundations of community health approach and talk about, you know, housing sets the tone for so many different things. You could be a part of advancing the success of your community and whatnot. And smoke-free policies are one way to get kids achieving higher, all those different things. And then they might think about that ask a little bit differently. So anyway, so this When You Say They Think tool has lots of different examples for the 4 sectors, like I said, with some common asks that we might have in public health and how we can reframe it to make it more, to make it resonate better with those potential collaboration partners. So the next tool after that is Answers to Tough Questions. And we might not think these are tough questions because we say them all the time, but there are better ways to probably respond than what we typically do. So a lot of times, I guess when I first started, everyone's like, oh, you work at public health, what do you do? And I was like, well, what do we do, you know? And so I'd rattle off something. Typically, the standard answer might look something like this. You know, public health is what we do together to ensure everyone has a chance to be healthy. It's protecting, it's promoting, it's responding, educating, advocating, all that kind of stuff. They have found that a better answer is listed here under the orange section. Public health is what we build together when we shape our communities so everyone has what they need for optimal health. And then it gives some examples. Again, it talks about a stable and strong foundation. We talked about foundations of health being a key term there. So it gives examples beyond the typical public health, disease outbreak things like education, safe and affordable housing, safe drinking water, access to safe parks. So maybe some things beyond the traditional public health services that we truly are still having an impact on, but more on a community level, all working together. So anyway, so those are just some examples. There's a bunch of common questions and some better ways to reframe it to make it sound more like a public health 3.0 message versus a standard public health message. The next option, there is a area for sample email. So if you're someone like me and maybe many of you are working from home or you can't have meetings in person anymore, email is about the only way we can communicate really well. So there's a bunch of sample emails here too for the 4 different sectors, showing you how to craft a good introductory message to get your foot in the door for with the different sectors. So again, it's talking about what you should, making sure you know the audience, making sure that when you include your ask, you're also including why they should invest, what they're going to gain out of it, proposing a solution to whatever problem or what request that they're experiencing, just making sure you have all those pieces in play. So it gives you some examples for like if you would want to meet out the housing or reach out to the health systems or business systems. These are some examples. So certainly can look into that. And then there's a couple other ones that I'm not going to get too in depth with because I want to save time for some questions, but there's stories from the field, which are, I think, fun to read. And this hopefully will continue to grow now that the toolkit's live. I'm hoping more health departments across the country will submit ideas that they can include, but these are just examples of how community partnerships have advanced the public health for that region or that community. So here's a success story about revitalizing communities in Chicago, affordable housing in California, complete streets in North Dakota, Tobacco 21 in Kansas City. So if you're working on any of these areas, you might want to look into the success stories and see what other communities are doing and how they did cross collaboration to advance some of their public health initiatives. Again, with the thought that it's just not coming from public health, but it takes a village to move these things forward. So I'm hopeful that this area will continue to keep growing with more and more stories now that the toolkit's live. Which I should mention, if you feel like you have good collaboration stories that you want to share and feature, there is a contact button up here. So if you go to contact, you can submit your email and then they'll reach out to you and ask you for that information so we can continue to grow examples for people to learn from. So never stop sharing your successes. There's also a sample documents page. I myself haven't got too far into this area, but you're welcome to look into it. These are just examples of like MOUs if you're trying to create formal partnerships, logic models, how to build a good strategic plan. Some of this stuff can be found other places, but there are some helpful tools there if you feel like you need some formal partnerships in place. And then, oops, I didn't go to the toolkit. There's a resources library, and it's also a tab up here as well. And this just has a lot of additional information. A lot of the background information that we did to build the toolkit is here. The art and science of framing, like I said, why it's important on how you frame a question to get kind of the change that you're wanting to invoke in a person. Different examples of collaboration, how housing and public health work together, how education and public health can interact, how hospital systems and public health can interact, all that kind of stuff. So you can click into each of these and gain a little bit more insight on some examples again across the country of how those kind of cross sectors are working together. So that's basically the toolkit in a 15-minute spiel. Down here, there's some related resources I already talked about them, but the mapping the gaps just shows you again where people maybe miscategorize what public health is or assume things that maybe aren't as accurate as they could be. The strategic framings that I talked about in April, and then of course framings. So that's all I wanted to share with you guys. Obviously, we're kind of probably many of you, like myself in our department, are still swimming in COVID. And so we're not necessarily thinking about building more partnerships and collaborations. But I myself, I was just talking with these Dr. Spani and Lena before the session started. And, you know, I have used the tools a little bit just with COVID myself and making sure that the messages we're sharing resonate with people. You know, there's kind of one of the things that we learned in phrases is that a lot of people have health as an individualistic mentality. So it's our personal choice. We take personal responsibility, and there's some truth to that. But as public health, we want people to think of health as a responsibility of everyone to improve the health of their community. And so that really should dictate how we share our messages too, so that it does create some sort of draw for them to get involved and to participate and to want to be a part of the solution versus just, oh, well, that's someone else's problem, or I don't have COVID, I don't have to wear a mask. But, you know, really, why should everyone be wearing masks for the common good and that kind of stuff? So I have found it a little useful just for COVID, but I really think it will get more helpful as we start to resume our other programs again. And you know, COVID's probably given us a great platform for that, because we're talking to a lot of people right now that we probably didn't usually. It might just be about COVID, but at least it's opened the doors that now we can branch off of that and build it to other public health initiatives. So, all right, I'll stop rambling.
Thank you, Kelly. That was fantastic. I really appreciate that introduction to the phrases toolkit. Over the summer, I had the opportunity, I don't remember now if it was a webinar or I just happened upon it, but I was sort of dabbling a little bit, but I really like how you brought us through it and kind of navigated the different pieces. I think I agree with you that framing the element or framing piece is really useful. Just a couple things that came to my mind as I'll just remind people that we are going to open up the session to questions. So if you have questions, you can either type them into the chat and we'll be monitoring that. We'll also open up in just a minute so that you can ask questions live to Kelly. We would love that. I was just gonna say, as we move into the questions, you brought up about COVID. This is really, you know, an important time for public health. We're in the spotlight every single day. Other issues from this year, you know, there are many cities across the country, cities and states that have declared racism as a public health crisis. And so there are going to be many, many opportunities for public health to partner, to be able to talk about what we do. And so I think this is a great time for this kind of toolkit to come out and for us to remember that language and words count. And, you know, thinking about how we can really be effective in spreading our message and what we do and why others can be part of that, you know, how we can work together, as you said, to build healthy foundations. That's great. Thank you very much. All right. I'd like to open it up to people that might have questions. If you've used the toolkit or you're knowledgeable about the toolkit, we'd love to hear about what your experience has been, or if you have specific questions that Kelly might be able to address around using the toolkit, feel free to do that. As Lena put in the chat, all of you are now able to unmute yourselves, so feel free to go ahead and unmute. If you would turn on your camera too, so we can see who you are. Oh, come on now, this is public health. I know you're not shy. I know that you have questions out there.
I guess I'll ask my own question, but this isn't necessarily a question, just an observation. So a lot of my colleagues, you know, typically the ones who jump on these type of lunch and learns and stuff like that are probably the ones who are already engaged with communications and collaborations and all that kind of stuff. But a lot of times it's our colleagues who maybe the frontline people who don't even jump on these that I think the toolkit would really be Thinking, one of my coworkers, she works with tobacco prevention, multi-unit housing, and she does a fabulous job, but she's just got that personality where she's super nervous about, oh, can you proofread this letter? I hate making cold calls and stuff, and I'm just nervous that all that kind of stuff. And I feel like these kind of tools would be helpful for those people who are maybe just first getting into public health or aren't real comfortable yet with the speaking or the cold calls or the emails or whatever, and just helping give them, looking at a few examples on the site might give them some courage to craft their message and to make that first send and that first contact.
That's a great point. I was also thinking about it from the perspective of students or people that, as you said, are new to public health. Even just going through them, you get a better sense of how you could be talking about public health and how you could be sort of highlighting different points. I wanted to ask a question that came from the chat. The question is, does the toolkit address approaches for correcting misinformation and disinformation? So in other words, especially when you're approaching partners who might have their perspective of what public health is, does the toolkit address anything about how you can sort of address the myths or the misinformation?
They're under the answers to tough questions, I think. It gives a little bit of information on, just kind of the misconceptions that people have on certain things and how to clarify that. But gosh, yesterday when I was looking through some of this stuff, I think it was in the resource library, I can't remember. I came across a thing that literally referenced this, how to correct your mistakes or how to correct misinformation in the media. And I wish I could remember where it was, but it was somehow I clicked one of the links in the resource library and it got me to some information. So I'll go back and look, see if I can find it, and I'll send it to you guys if I do. But maybe you can try to search it and it might pop up on the website. But that is a great question. That would be a great tool.
Yeah.
I'll pass that on along if it's not there already.
Sounds good. Other questions or comments, maybe an experience you've had in work that you're doing with other sectors and how you on your own approached some of these things and now you're going to look back at the toolkit to see if it was captured there.
Yeah, I guess a big thing with just me and our health department is we're kind of still in that middle ground between, we want to achieve 2.0 kind of functioning, but we're still kind of set in some of our programs in our old ways and stuff. Some of our staff are still in that old school, but traditional style of public health. Mm-hmm. Who come in and are thinking in a completely different way, and it's hard to meld them together. So we're hoping that this toolkit and stuff I'm going to present to our staff here probably this fall yet, kind of get everyone on the same mindset of what is public health 3.0 and why is it important. That way we can get everyone thinking in the direction again at our department. So that might be a good first step for a lot of small health departments. Maybe they aren't even thinking about public health 3.0. This toolkit would be like, we don't have anyone who works in housing and things like that. So maybe it's just truly just the informational tool right now where it just gets them to maybe start thinking about what's beyond traditional public health services and how could we even be doing more as time goes on. So that's how we're going to use it internally at first, just kind of brief everyone on the importance of public health 3.0 and how that transition is kind of going to look using the toolkit as some support.
Excellent. Kelly, one of the things that you and I talked about was how the purpose of the toolkit really seems to be around communicating the value of public health, sort of generally, and not so much specific topics. And you mentioned some of those topics, and I think you pointed to some of the stories from the field around tobacco or around housing. Do you anticipate that there will be examples on the website, specific phrasing for obesity or, words you can use for health equity.
Yeah. I don't know if they'll get real specific in the tools themselves, but they might be in the success stories when people start submitting those more. I know right now there's a couple on housing, appropriate housing, tobacco prevention, that kind of stuff that get a little bit more specific. I think in my training in April, I showed an illustration of the University of Iowa around binge drinking in colleges. And, you know, the message was always like, binge drinking is a problem in Iowa. College campuses can't get it under control. You know, and public health was trying to make some efforts, and it was just falling flat. And so they revamped their message, and the president there at the time put a quote in the newspaper, and it was some, you know, she had mentioned that, you know, college students don't set the hours that a bar is open. They don't set the drink specials. They don't set, you know, all this kind of stuff that took the ownership off the individual and really made it look like a community issue, so that a lot of different sectors and stuff felt the need to get involved to make it a topic. So I think you'll find more examples in success and the success stories versus the actual toolkit itself with the specific tools. But that's just my thought.
So one of the things that you mentioned to me as part of being a fellow with the De Beaumont Foundation was that now you are going out and talking about the phrases toolkit. You're sort of helping to disseminate that it's available and what it can be used for and so on. Is there a way to determine who is using the toolkit? So is De Beaumont going to be capturing any information on this or evaluating whether people are using it and how they're using it?
Yeah, so that's a great segue to my last ask. We have been asked that everyone who gets introduced to the toolkit through a presentation like this from a fellows complete an evaluation. And I'll throw it in the chat here, but if you have a second after the meeting to complete it, that'd be appreciated. But it just asks questions like, what do you think, what tools look like the most interest of you? Which ones do you think you'll use? Which ones, you know, do you not think you'll use? That kind of stuff. So this toolkit's supposed to kind of be a working document itself, and they want to take all and capture that information as we start to use this toolkit throughout to really find out and fine tune those things that locals are finding most useful and the things that, you know, aren't resonating with us as public health professionals locally. So I'm sure there'll be some misses and some hits as we get that feedback on what people really like and what we need to expand and things that just can stay where they are. So yeah, I'll throw that in the chat, but that's one way to provide feedback. Also, when you're on the site, it's got one of those features like most websites where it will pop up with a feedback button after you've been on the page for so long. And you can also submit your comments that way to help them improve.
Excellent. All right.
This is Cheryl Jones. I hope you can hear me. I work with child health specialty clinics. I'm a nurse practitioner in Ottumwa, work with children and youth with special needs. But in reference to the comment about how do you deal with misinformation, I wish I'd have had this presentation before we did some of the things that we've done in Davis County. I'm the chair of the prevention of Child Abuse Prevention Council there. And one of the things we've done, because we feel child abuse prevention is broad, it isn't just not having kids beaten up, it's what do we do to protect our kids? And one of the things we felt with COVID was let's encourage children and adults to wear masks because it protects everybody. So we purchased masks with the school logo from funds we had, and we partnered with public health in the county and got those out and did a newspaper article. Well, we did not have necessarily the information we probably should have had about how do you message. And there was a really good article, and I don't know if you've seen it, but it came out from the Public Health Institute on how to counter misinformation about masks. And it talked about phrasing, just the things you were talking about. And I thought, oh man, it came about a week too late for our article. But it talked about, again, just what you were talking about here, but focused on masks. And I do think from the perspective of folks in the county who come to you, and our mask usage in our county is low, who say it's my right as a citizen. I can do anything I damn well please. Nobody's going to tell me what to do. And so if you haven't seen that article, and I can share it with folks at IPHA if you'd like, but it was a very good article that talked about terminology to use, how to do it. But I do think there is so much, it's not just about masks, it's just about everything in general, about basically, I think, trying to make it sound, well, basically an effort to make it that people with health backgrounds, public health backgrounds really are not, we don't know what we're talking about. Just politicians. Actually, someone just said politicians should be making these decisions about when we open schools and go back to work, not health professionals. So I think we have to have a better way of speaking about these things. And this toolkit to me is an excellent thing, but the other one was that article, and I'll share it too. If you I don't know, maybe the rest of you have seen it, but I found it extremely helpful on even verbal discussions about using or not using masks. So anyway, just a comment.
Wow, that's a great comment. Thank you very much. And we'll definitely find that article. If you have a link, or if you can give us some information, we can make that available to people, because I think we're going to be talking about masks for a while. So having some of that language would be good. Other questions from the field? Comments are good too. Oh, good. Somebody did put the link for the article in, so that is excellent. Okay, well, like I said, Kelli is no stranger to IPHA, so you know where to find her, Cerro Gordo County. And I'm sure that, you know, if you have specific questions or you want more information, you can reach out to Kelli. Please go to the phrases.org website. It looks like a lot of great information, and it looks like, you know, as people start using the toolkit, there will be some good stories and good examples of things that we can use. All right, I'd like to thank Kelli for sharing her thoughts and her experience working on this project, and to thank all of you who shared your lunchtime with us. We hope that everyone will join us again next month for lunch on Thursday, October 15th, when we're talking with students from around the state. They'll be talking to us about their experiences in academic public health programs. And so that will be an interesting piece, especially since many of you work in agencies where students, you know, may have the opportunity to do internships or practicum projects and things like that. So this will be a really interesting one. The IPHA Education and Programming Committee is planning events for the rest of the year. So if you have some good ideas, if you want to, you know, be part of this committee and help us to plan education and programming for IPHA, we would love to have you. Just reach out to Lena, and she's happy to share your information with me and with the rest of the committee. As a nonprofit organization, IPHA relies on membership dues and sustaining donors to support our mission. If you are not already a member, please consider joining IPHA. If there are any students out there, please check with your department chair or someone at your college, as sometimes there are academic programs out there that have funds to support your membership. And if you're already a member, thank you, and we appreciate any donation that fits within your budget. You can join and give at www.iowapha.org. Recordings of all of the Lunch and Learns will be archived on the Iowa Public Health Association's YouTube channel, where you can also find some of the webinars that happened earlier this year that you might have missed, or you want to revisit, or you want to share. Thank you again for participating today, and we'll see you next month.